Hi, I am Ancy, Assistant Professor of Biomedical Department from Emmanuel Research, JJ College of Engineering, Nattalam. Now I am teaching about ECG. ECG, what is ECG? ECG is an electrocardiogram. ECG is a device used to record the electrical activity of the heart. The ECG is a simple and non-invasive test. It helps diagnose various heart conditions including abnormal heart rhythm and coronary heart disease. During the test, electrodes are placed on the skin to capture the heart signals from different angles. The result can provide insight into heart rate, rhythm, and overall heart health. Additionally, ECG, by using the ECG record, some devices may be used like Holter and smart watches. This is a normal ECG waveform. Normal ECG waveform having PQRST wave. There are three main components to an ECG wave. First one is P wave, next one is QRS complex, then T wave. P wave which represents depolarization of the arteria. What is depolarization of arteria? Depolarization of arteria means electrical activity of the right and left atria of the heart, that is upper chamber of heart. QRS complex. The QRS complex which represents depolarization of the ventricles. Depolarization ventricles means electrical activity of the right and left ventricle, that is lower chambers of heart. Final one is T wave. T wave which represents repolarization of the ventricle. What is repolarization of ventricle? Repolarization of ventricle means the recovery or relaxation of the ventricular muscle cell after they have contracted. This is electrodes and leads. By electrodes, 10 electrodes attached to the body are used to form 12 ECG leads, with each lead measuring a specific electrical potential difference. These electrodes are placed on right arm, right leg and left leg. In these, each electrodes having different colors. In right arm, white colors electrodes and left arm, black color, right leg, green color and left leg, red color electrodes are placed. Then 12 leads ECG. Leads are broken down into three types. First one is limb. Limbs are the leg or hand. Next one is augmented limb. Augmented limb consists of three augmented limb leads: AVR, AVL and AVF. AVR means augmented voltage right arm and AVL augmented voltage left arm, AVF augmented voltage foot, and pericardial or chest. Pericardial or chest having 6 leads, that is represented V1, V2, V3, V4, V5, V6. Electrodes should be placed in standard positions with the left or right referring to anatomical directions, being the patient's left or right arms and legs. The 12 standard ECG electrodes are listed below. All leads are effectively bipolar with one positive and one negative electrode. These are the patient undergoing ECG connection. These are the ECG electrode. This is normal 12 lead ECG waveform. Then medical use. Chest pain or suspected myocardial infarction. Suspected myocardial infarction means heart attack. Symptoms such as shortness of breath, murmurs, fainting, seizures or arrhythmias. Seizures means a sudden and brief of loss of consciousness. Seizures is a sudden and uncontrolled electrical disturbance in the brain. Arrhythmia means an abnormal heartbeat. Then electrolyte abnormalities such as hyperkalemia. Hyperkalemia means too much potassium in the blood. Then ECG should used in computer tomography and magnetic resonance of the heart. Thank you.